If we as a country have any hope to continue to provide this sort of access to prescribed drugs that Canadians deserve, we can't tinker with what exists. We have to transform it.
All Canadians would see their drugs covered, an end to the current patchwork of public and private insurance. A national drug agency would negotiate lower prices for approved drugs in bulk. But right now, these are just proposals. And with a looming election, the report amounts at this stage to a political promise. The parties are already weighing in. But first, Hannah Thibodeau digs into the proposals and what they might mean for Canadians.
Anna Kiff has been managing her diabetes since she was a kid. She hasn't had private medical coverage for years, and she's on a fixed income.
Yeah, I've had to dig into my savings.
Personally paying for most of her medication.
For myself, $5,000. That's what I pay out of pocket.
A national public pharmacare program would be a big help.
Everyone in Canada should have access to prescription drugs based on their need, rather than their ability to pay.
The council's plan? Canadians pay $2 for essential drugs, $5 for all others. No one pays more than $100 a year, and people with disabilities on social assistance and low-income seniors would pay nothing at all.
It would be a phased approach with so-called essential medicines covered by 2022. And that's about half of all current prescriptions, and a full list of drugs covered by 2027.
A national formulary would replace the patchwork system currently used across the country.
In other countries, the list of medications that are publicly funded range from several hundred to around 1,000. So we could imagine a similar situation in Canada.
The cost estimate? $15 billion by 2027. And like Medicare, it'll be covered by the taxpayer. The chair defends that, saying those costs would be lower than what Canadians would pay without a pharmacare plan.
By creating a single-payer public where you've got everybody coming together and one negotiator negotiating with pharma and getting the lowest possible drug that would apply then to all Canadians and all prescriptions.
For millions of Canadians like Anna Kiff, what happens to their drug costs will depend on the outcome of the fall election.
Yeah, pharmacare is one of what I'll be looking for. That's a definite choice for me.
Hannah Thibodeau, CBC News, Ottawa.